Hi, I'm Dr. Siobhan Dolan, and today we're going to talk about getting pregnant. We're going to talk today a little bit about getting pregnant. One major recommendation we make is to start on a multivitamin or prenatal vitamin that contains folic acid. It's best to avoid smoking, to avoid alcohol altogether, and to avoid any drug use. It's not a good time to stop any medications straight out, but sometimes you can fine-tune or alter your medications in consultation with your doctor.
Should I go back to my regular physician, or should I go to my OBGYN?
You should probably do both. See your OBGYN doctor or a midwife, whoever is your healthcare provider. Now the other question is birth control. Have you been using anything for birth control?
Yes.
Okay, because that's something you want to stop. So if you're on the pill, you want to stop taking your birth control pills. If you're using condoms, of course, stop using them. When you stop the birth control pill, the recommendation is to usually wait about 3 months before trying to become pregnant. There's a few reasons for that, one of which is to start to understand your cycle again, and the second of which is to let your uterine lining start to build up to normal sort of depth each month. Now, when we talk about keeping track of your cycles, there's a common way to do that, which is to keep a menstrual diary or calendar. The average woman's cycle is about 28 days, although that really can vary. It can be as short as 23, 24 days. Some women have a longer cycle, up to 32, 33 days. And then some women have very irregular cycles with sort of no rhyme or reason to them. The first day you get your period is day 1, and then days throughout the cycle are going to be referenced with regard to that day 1. The average time to get pregnant is right in the middle of that cycle. The other thing that a couple can do is use an ovulation prediction kit, something you can buy in the pharmacy or the supermarket, and it's an at-home test that will tell you if you're actually at the time of ovulation. If you use an ovulation prediction kit, that can give you some timing advice as to when to go ahead and have intercourse.
If my cycles aren't regular, how can I tell if I'm ovulating?
We've talked about 2 methods. One is to keep a menstrual diary, and the second is the LH prediction kit. But there are some other methods that you can use. When you ovulate, your temperature goes up on average about 1 degree. So what you need to do is go to the pharmacy and get a thermometer that's scaled to pick up 1 degree temperature change. So it's a special thermometer. Put it right by your bedside stand, and then every morning when you wake up, before you get out of bed, before you do anything, take your temperature. Record that in your diary as well as recording when you have your period. The last thing you can look at is your cervical mucus. Women suggest that around the time of their ovulation, their cervical mucus can be somewhat thinner, clearer, more slippery, and that could be another indication that you're ovulating. There are tips for men, which are to avoid drug use, especially the use of marijuana. There's that whole joke about boxers and briefs, but basically your sperm are in your testes, and those are outside of the body for a reason. They're supposed to be in a cooler temperature. Sometimes people say to not wear tight-fitting pants and briefs as a way to keep the sperm at the appropriate temperature.
I'll sit with my laptop on my lap, so Allison advises that I shouldn't be doing that.
Yeah, no, that's a good point. I understand what you're saying, and I've never read any data about that, but I do think it would make sense to potentially have a little tray. Stay relaxed about getting pregnant. It's a great time to go ahead and try. There are a few signs that indicate you are, in fact, pregnant. You'll know you're pregnant when you miss your period, you feel sick to your stomach or throw up, your breasts are big and sore, the area around your nipples gets darker, you crave certain foods, or you really dislike certain foods, you feel tired all the time, and if a home pregnancy test shows you're pregnant.